One day, you may find yourself lying beneath the bright lights of an operating room. A doctor will ask you to count backward from 10. Before you even reach the last few numbers, the world fades, and when you wake again, the operation is already over. Today, that feels normal, but for most of human history, surgery offered no such comfort. If you needed an operation in the early 1840s, you walked into the room fully awake. You watched surgeons lay out their instruments. You heard every sound, and you stayed conscious through every moment. The pain was unimaginable, but so was the knowledge that there was no escape. It's almost impossible to picture now, but survivors wrote down exactly what it felt like, preserving those terrifying experiences for history. One of them was in London in 1842. 3 days ago, a cartwheel crushed your lower leg. The broken bone tore through the skin. Now the wound has darkened, and it smells sweet and rotten at the same time. The surgeon examines you for less than a minute, then gives you two choices: lose your leg in the morning, or let the infection reach your blood and die within a week. Surgery wasn't for minor things. People agreed to it only when death was the other option, and still many refused the knife. That evening, sleep doesn't come. In the morning, two assistants help you climb the stairs because the operating theater sits under a skylight. Surgeons work by daylight, and the word theater is literal. Wooden galleries rise in a horseshoe around the table. They're packed with medical students who come to watch. The table is plain wood, darkened by years of use. Beneath it, a fresh box of sawdust waits, and you understand immediately what it's for. They give you a glass of brandy, maybe, if you're lucky, a dose of opium, and a strip of leather to bite. But everyone knows none of it will dull the pain. The brandy is only to steady your legs long enough to reach the table. Then the assistants hold you, one for each limb. Patients always fought, not from cowardice, but because the body will try to get away. And we know what came next, because the patients wrote it down themselves. In 1811, the novelist Fanny Burney had her breast removed in Paris with only a thin handkerchief over her face. Through the fabric, she watched the polished steel come down. She later wrote, "I began a scream that lasted unintermittingly during the whole time of the incision." The operation took about 20 minutes. She fainted twice, and each time woke back up in the middle of it. Months passed before she could even bear to write about it again. She carried the memory for the rest of her life. A few years later, a Scottish chemist named George Wilson survived an ankle amputation just before anesthesia arrived. He remembered every detail with what he called preternaturally acute senses. He heard the instruments being laid out, felt the tourniquet twist and the first cut, and what he described as the fingering of the sawed bone. But for him, the deepest wound wasn't pain, it was desertion. He wrote of the black whirlwind of emotion, the horror of great darkness, and the sense of being deserted by God and man, bordering close upon despair. That was what surgery felt like, not just agony, but abandonment. The surgeons of that era weren't monsters. Their only weapon against pain was speed. At University College Hospital, Robert Liston made amputation a race. He could remove a leg in about 2.5 minutes. Students pulled out pocket watches to time him. When both hands were busy, he would clamp the bloody knife between his teeth. Speed was mercy. Less time under the knife meant less shock. Still, roughly 1 in 6 of his amputation patients died. In other London hospitals, the number was closer to 1 in 4. And then, the more famous story, whether fully true or not, shows how speed could turn tragic. During one leg amputation, Liston allegedly sliced through the fingers of his own assistant. The patient died of gangrene, so did the assistant, And a spectator, convinced the flying blade had stabbed him, supposedly dropped dead from shock right there. If true, it would be the only operation in history with a 300% mortality rate. But surviving the cut was only round one. Nobody yet knew that germs existed. Surgeons wore the same frock coats for years, stiff with dried blood, a badge of experience. The ward smelled so strongly that nurses gave it a nickname, the good old surgical stink. Instruments were wiped and reused. Sponges that cleaned one wound had just been used on another patient. So, days after the operation, the fever often came. And when pus appeared in a healing wound, doctors sometimes called it laudable. They thought it meant recovery, but it was infection. In big city hospitals, 4 out of 10 amputation patients never left alive. Most died not from the knife, but from what came after. James Simpson, the surgeon, compared the odds to battle. A man on a hospital table, he said, faced more chances of death than an English soldier at Waterloo. Then Ignaz Semmelweis, a Hungarian doctor, showed with numbers that when doctors simply washed their hands, death rates plummeted. But the medical establishment treated this as an insult. They insisted that a gentleman's hands could not possibly carry disease. Semmelweis was ridiculed. His career collapsed, and in 1865 he died in an asylum from an infected wound, the same danger he'd warned against for years. For patients, this was the deal. Bear unspeakable pain from the fastest blade you could find, then gamble on infection. Then, on a morning in October 1846, in Boston, something changed. A young printer named Edward Gilbert Abbott lay on a table with a tumor in his neck. The galleries were full. The surgeon was John Collins Warren, an experienced man who had spent his career cutting into screaming patients. A dentist named William Morton arrived late with a glass inhaler filled with ether vapor. Most people thought it wouldn't work. Morton had Abbott breathe from the device until he went limp. Warren made the first incision, and for the first time in that room, there was silence. No one screamed. No one strained to hold the patient down. Just a man sleeping while his neck was operated on. When Abbott woke up, he said he felt no real pain, only a dull sensation, as if his neck had been scratched. Warren, the old surgeon, turned to the stunned gallery and said, "Gentlemen, this is no humbug." The news crossed the Atlantic by steamship within weeks. On December 21st, Robert Liston himself tried ether, amputating the leg of a butler named Frederick Churchill while he lay unconscious. Out of habit, Liston still finished in under half a minute. Churchill woke and asked when the operation was going to begin. He didn't believe it was over until they showed him the stump. For years, some surgeons had chased painless surgery through mesmerism, trying to hypnotize patients out of feeling the knife. Liston summed it up in one sentence: "This Yankee dodge, gentlemen, beats mesmerism hollow." You'd think surgeons everywhere would have celebrated. Many refused. Some argued that pain was a stimulant, something the body needed to survive surgery. During the Crimean War, a senior British Army surgeon advised against chloroform because he said it was better to hear a man bawl lustily than watch him sink silently into the grave. Others claimed that enduring the knife was a test of manhood and that sleeping through it was cheating. In 1853, Queen Victoria took chloroform to deliver her 8th child. Once the Queen had chosen painless, the objections looked ridiculous. The other killer, infection, held on longer. Wards kept emptying until the 1860s, when Joseph Lister began attacking germs with carbolic acid, The fevers finally began to fade. Tonight, someone lies on an operating table. Their body is open to the lights, and they will remember nothing. Tomorrow, they'll wake up sore, press a button for painkillers, and complain about the hospital food. Fanny Burney would have called that a miracle. George Wilson would have called it the end of the Great Darkness. For thousands of years, being saved by the knife cost more pain than most modern humans will ever feel in a lifetime. Then, one October morning in Boston, the price dropped to nothing. And in your lifetime, it has stayed at nothing. Counting backward from 10 and waking whole. That's the whole story for you now. People once held down on those wooden tables would have given anything to trade places with you.